So hi, we're about to start a moustache transplantation for this patient. So he has a scar on the upper lip and the hair isn't growing there. So we're going to be taking some hair follicles from the back of his head, the permanent follicle, and transplant it in the upper lip. Now this is a beautiful technique. We really don't get rid of the scar, but we camouflage it, we hide it. Now it's very useful for also patients who have any other reasons, scar on the upper lip. The most common reason that I think of when I encounter is patients with cleft lip. Now you might be a fact that the patient's not keeping moustache. You're clean shaven like how I am, but even then, if you have a scar here and you put the follicles really take the shiny aspect of the scar and there's uniformity in the entire upper lip. So it's a beautiful procedure, it's a simple procedure that we can do under local anesthesia as a day care, and this video that follows this, you will see how we do the entire procedure. Thank you. So we're doing moustache transplantation for this patient, and the reason is because he has a scar on his upper lip. You can see how the scar is thick and it's devoid of hair follicles. There's also a scar in between here which he's trying to cover with his moustache hair, but it's still visible. The density is less. So we're going to do all of that. It's going to be done under local anesthesia. So we're shaving some of the hair here. This is for preparing the recipient, the donor area. So we will be harvesting the follicle from this area, and I use those follicles in the moustache, making a small window like this so that once you take the tape off, then it's not going to be visible, so patient can go on with their normal life. Put the patient in the right position now. So the next step is to give some local anesthesia, numb the area, and then to harvest the graft. So it's been draped and prepared. The next step is to give local anesthesia. So you see we're using these diabetic syringes. These are 1 ml syringes. They come with very, very tiny needle. I hope you can see the size. So that's hardly painful for the patient. Yeah, so the patient has very, very minimal pain. He can just feel it probably, but he's comfortable. You see he's not moving. So you see how the injection is injected slowly. Okay. So we started the process of using the slit. You can observe how the hair follicles are popping out. You got to be very precise. Separating the follicles, and it's going into this petri dish, and the petri dish is kept on top of a bowl that's with ice. So you want to make sure the follicles are the right temperature so it lasts longer before you transplant it. And you can hear the sound of the motor. The process of harvesting more follicle goes on while this team is sorting out the follicles and placing them in the right container. So that's all the follicles that we've got. We've gotten a little more than what we need. Obviously that's safer because we don't want to go and harvest again. So now we are preparing the moutache site. You can see the So we're injecting the tumescent now into the area where we're going to do the transplant. We've already given the blocks, bilateral and infraorbital blocks, so the patient's going to be comfortable. Again, it's an insulin syringe, as you can see. Clearly see the scar now. So we're going to cover that scar with hair follicles. So once the hair would grow, the scar would not be conspicuous, would not be visible. So as you see, this is a painstaking process. Each and every follicle is pricked and placed inside. And since the lip is made of muscle, it's mobile, so you need to have an assistant to hold the lip tight for you. And then another one to place the grafts and to keep it wet. And then you can just keep placing them in. That's about the 12th one now. A lot of these are multiple follicles. You can see there are 2 or 3 of them. So that's going so that we get the density of that region. So you can see 3, 2, 1. A lot of them are multiple. So as you see, this is a painstaking process. Each and every follicle is pricked and placed inside. And since the lip is made of muscle, it's mobile, so you need to have an assistant to hold the lip tight for you. And then another one to place the grafts and to keep it wet. And then you can just keep placing them in. That's about the 12th one now. A lot of these are multiple follicles. You can see there are 2 or 3 of them. So that's going so that we get the density of that region. So you can see 3, 2, 1. A lot of them. You see, it can be a little bit of an ordeal towards the end. When you put in one follicle, the other one tends to pop out. And gotta be very patient. So there you go, that's the immediate result. It's a little bit easy, not able to get this zoom. Yeah, that's better. Okay, so you can see the follicles. And that's in the exact shape of the moustache on the other side.